So, good morning and welcome everyone to this Nursing Now ICN webinar. Bienvenue et bienvenido a todos. And good afternoon for those of whom it's later in the day. I am a consultant working with the International Council of Nurses at the moment to coordinate the transition of Nursing Now, both the groups and the legacy of the campaign to ICN, and build on all of the wonderful momentum and hard work that the groups have been engaged with as part of the Nursing Now campaign, which finishes in May this year. This is the first of two webinars. The next one is on the 18th of February. We'll have a few introductions at the beginning from ICN and Nursing Now, and a chance to meet some people from the ICN team who are particularly going to be working with the Nursing Now groups. And then we've got some short interventions from three of the Nursing Now groups who are going to kick off the debate on what their hopes and aspirations and plans are for 2021, and also how they would like to work with the International Council of Nurses and its member national nurses associations. But mostly this webinar is about you. We want to hear from you. We want to hear about your plans at national, local and regional level. We want to hear about how you would like to continue working in the future so that we can continue to strengthen the profession and increase our influence on global health and nursing policy. If you have any questions or comments that you want to make, you can already be posting those in the Q&A section as we go along. And then we can collect them for the debate in the second half. Obviously, if you want to also register that you're here and chat and say hello, you can put those in the chat section. So that's the practicalities over. I'd now like to hand over for our first introduction from Howard Catton, who is the Chief Executive of the International Council of Nurses.
Hello, everyone. A pleasure to have you joining us for this webinar this morning. And we're delighted that so many of the Nursing Now groups are going to be joining us today at a webinar that we've also got in a couple of weeks as well. But also I can see from a number of names who are with us this morning, and also some of our speakers, that many of you have already joined ICN events over recent days and indeed over the last couple of years or so. But for those of you who don't know what ICN is and what we do, let me just very, very briefly give this introduction. ICN was founded back in 1899 and is the international organization that represents nursing to the global institutions. We have a special status with the World Health Organization that means that we can participate in policy making, we can advocate at meetings on a whole range of issues. But it's not just WHO. We work with organizations like the International Labour Organization, the International Organization for Migration, the UN Child Agency. We work with MSF, Doctors Without Frontiers, the International Red Cross, to name but a few. And our membership are national nursing associations. We currently have more than 130 national nursing associations that are in membership. Our national nursing associations, they're not all the same. Some of them may take a lead in terms of advocating for nurses in relation to workforce issues, pursue some of perhaps trade union type functions. Others focus on professional activities, advancing the art and science of nursing. Some are regulators, and some are a mixture of all of those functions as well. So that's a little bit about ICN for those of you who are not familiar with us. ICN has proudly been part of the Nursing Now campaign. It's been a phenomenal campaign. I think it's without doubt, the history books will, I'm sure, speak to this, say that it's been the most successful global nursing campaign that there ever has been, and the activity around the year of the nurse, the work together on things like state of the world's nursing, and in very real terms, the groups, the groups who have established around the world are, the hard and fast results of the great success that the Nursing Now campaign has been. And we want to work with that legacy. We want to work with you. We want to take the campaign to the next stage, the next level. There is clearly much more for us all to do. Those of you who've been involved in some of the ICN webinars just recently will know that we have focused on the response to the COVID pandemic, the work that's being led globally by Helen Clark in relation to learning the lessons from the pandemic. You'll know that we're working extremely closely with WHO on the development of the next strategic directions for nursing and midwifery, the next global nursing strategy. You'll know that we have produced a number of reports over the last few months in relation to the extent of the nursing shortage and what needs to be done to educate and to invest in the nursing workforce. These are just some of our priorities. There are many others, and I'm not going to go through go through all of them. But today, as Susan said, is very much about us wanting to understand more about you and your groups, what your priorities are, what issues that you're working on, but also to understand how you've come together as groups, who's involved, and how you may organize yourselves, how you decide on issues that you're going to advocate on, and the issues that you will have thoughts and ideas and views on that you want to work closely with ICN on. And we're very much looking forward to hearing all about that today and in the following webinar that we've got as well. One final thing from me, everyone, is that as we all know, last year was the year of the nurse and the midwife. This is the official year of the health and care worker. WHO made some announcements about that at the beginning of the year, and just in the last few hours have now launched the website for the year of the health and care worker, and they're putting the protection of nurses firmly at the heart of all of that. ICN last year first called for nurses to be prioritized for a vaccine once it's available, and with our national nursing associations have been tracking and monitoring that. And I'll be honest with you, we're concerned that it's not happening as quickly as it should for healthcare workers in all countries. So whilst we're hearing from you this morning about your priorities and your actions, there's one very practical thing that I would like you all to do, please, is to put in the chat box the name of the country that you are from, And if vaccinations for healthcare workers has started, just put the name of the country and say yes. If it hasn't, but you know when it's going to start, put the name of the country and say the month that the vaccination of health workers is going to start. So you might put April or May or June or December. And if you don't know, just put the name of the country and say don't know. So the name of the country you're from, yes, the month that vaccinations for health workers are due to start, if you know it, or it might even be the year. You might not know it's this month, you might just know it's going to be 2021. If you don't know, just put don't know. So one very, very practical thing that you can immediately start, we can immediately start to work together on. Thanks very much, everybody, for your time, and looking forward to hearing what you say. And back to you, Susan.
Thanks, Howard. And also thanks for that very, very practical example of how working together between the Nursing Now groups, ICN, and the ICN Nurses Associations, there's an opportunity to influence what's happening here and now on the pandemic. I'd now like to hand over to someone who I'm sure all of you know, Barbara Stillwell, who is the Executive Director at the Nursing Now campaign. Over to you, Barbara.
Thanks, Susan, and good morning, everybody, or greetings if you're a bit later in the day. Good morning from a very snowy England, where I live at the moment. It's unusual for us, but very pretty. But I'm glad I'm doing this from my study and not outside. It's great to be on this webinar, and thank you, Howard, for kind words about Nursing Now. I have to say we're very proud of our team. I think they've achieved a great deal. You know, we've only ever been 6 people, and now we're down to 3. So, you know, we've only been a small team, but we've loved meeting you all, and the groups and everybody who's participated in Nursing Now. You have been our motivation. And I want to thank you for that and for all you've done and your enthusiasm. Tate, I see you there. Tate is one of our big participants, and we love working with you. Catherine Adeko was one of our early starters. And I see people in participants, Adela, for example, who was on our board. And I think what this shows to me is that what Nursing Now has done is connected people. We have relied on connections. We've relied on having great partners like ICN and WHO. You know, nobody can do everything, can they, all by themselves? So we've been really relying on our partners, and we're thrilled that ICN is going to carry on with this great work with the groups and be there, you know, to support you and continue these connections. One of the reasons I'm so pleased to be on this webinar is because it's all about the future. We're slowly fading here at Nursing Now. We've got 4 more months to go. But don't forget about us quite yet, because we have some really exciting things still going on, which we're doing with ICN and WHO. So one that I must remind you about, although I'm sure you all know about it, is our advocacy, our season of advocacy, which is called Nurses Together. So please look on our website for all about that. What we're asking you to do is to think about the case you want to make in your country for investment in nursing. And that's where ICN and Nursing Now, of course, align absolutely. We're all about investment in nursing, in decent work, in salaries, in all the things that nurses need. So please look at that. Now, we've also aligned with WHO, so you'll notice that we've called it Nurses Together, Invest and Protect in Nursing and the Health Workforce. See what we did there? So we've used Invest, Protect Together, which is what the WHO strapline for its year of the health workforce. And, you know, nurses are part of a team, and we do need to work together. So we're really behind that. And and supporting that. At the same time, nurses have particular characteristics as a workforce. We're 90% women, for example. We have a range of different types of qualification. We need regulation. We're the biggest component of the health workforce. All these things make us special, make us, what we need to do is to be able to tell our story in a way that captures the attention of policymakers. So that's what we're hoping to do through our advocacy campaign. We won't do it without you. So please join us. Please post pictures of you talking to your Prime Minister, you talking to your Health Minister, you advocating for vaccines, you talking to Howard Catton. Please post us those pictures, tell us those stories. And then in May, we're going to have a big final celebration, which will go round the world. And we hope you're going to join that. We'll be working with ICN, with WHO to make that a really big splash. So please don't forget us quite yet. We're thrilled to be looking at the future with ICN. ICN have been fabulous partners. We know you're in safe hands. Thank you so much. Thank you, ICN, for inviting us.
Thanks, Barbara. And you are unforgettable, so we certainly won't be forgetting you or Nursing Now or the team. Before I hand over to our first speaker, just a quick thank you to everyone who's already really quickly responded to Howard's question about health worker vaccinations. Please, if you haven't yet, please do go onto the chat section and just give us the information about whether the vaccinations have started, and if you know when they should be completed, that would be great as well. So thanks for responding so quickly to that. That's brilliant. So now over to the Nursing Now groups. And the first group we're going to hear from is the Nursing Now group in Slovakia. And we're going to be hearing from Julia Jankovikova, who is from the Slovak Chamber of Nurses and Midwives. So look forward to hearing from you, Julia.
Good morning. Greetings from Slovakia. Nice to see you all. As part of the Nursing Now Slovakia campaign, we have had many plans and activities, but not all of them we have realized due to COVID-19. We presented the campaign as part of the nationwide activities organized for nurses and midwives, also in some health faculties for nursing and midwifery students. We prepared 4 short videos in real conditions where we tried to point out at the lack of nurses in midwives in Slovakia. And these videos were also posted to Alice Thompson. She's the research assistant in Nursing Now Global Campaign. We also held a press conference, which was broadcasted in the evening television news. We wrote several press releases. We also addressed the President of the Slovak Republic, who sent us a letter and expressed support in this difficult period. In Slovakia, we know that only about 60% of nursing and midwifery graduates will remain working. And in addition to the Nursing Now Slovakia campaign coordinator, I'm also an employee of the Slovak Chamber of Nurses and Midwives, as well as a university teacher at Slovak Medical University. So I can see the situation very clearly. We have indications that even after the pandemic, it will not be better. Society and government approach confirms them that working in Slovak healthcare system is neither socially, morally, and materially rated adequately. That's why, as part of the campaign, we plan to reach nursing and midwifery students, so to identify motivational factors that would keep them in the system. We could then prepare press release and interpret it to our government officials. And concerning to our plans for the future working with ICN, or how is possibly to work with ICN, it could be helpful. We have idea about or we have a vision about how would be that the ICN in cooperation with the WHO called on official countries to take concrete steps to address shortage in nursing and midwifery, discussions have to be conducted in the professional, not political way, what is also quite a big problem in our country. And we would certainly like to stay in touch with the ICN, not only because of information or media reports, but also of sharing information on the nursing and midwifery state in our country. So thank you very much.
Thank you, really, that's excellent, Julia. Some really practical examples of the work that you've done in Slovakia, including with the media and getting your voice heard, and some really interesting pointers for ICN there about how they can help to capture those wider global influences to support the work in country. So that's great. Thanks ever so much. I'm now going to hand over. Now, the next speaker is supposed to be Tate Hileng from Myanmar, and apologize in advance, the internet connection is not brilliant, but it seems to be good at the moment. So I'd like to hand over now to Tate Hileng, who's from the Ministry of Health in Myanmar, to talk about their plans.
Good morning, good afternoon, good day to all. First and foremost, I would like to heartfelt thanks to all responsible persons of ICNN National Group for taking part in this webinar. Let me express appreciation to National Campaign on behalf of Myanmar National Group. We are collaborated in developing strategic directions for nurse and midwife, organizing this kind of campaign which complement with strategic direction for nurse and midwife objectives is most welcome. National Myanmar is implementing 5 objectives. 1, more investment in education, professional development and regulation. 2, initiate nurse-led clinics for prevention of CDs and NCD. 3, promote enabling workplace environment. 4, promote leadership skills. 5, adopt exercise is a medicine for population. By the collective effort of Ministry of Health and Sports, professional association and regulatory body. Some activities related to these objectives have been implemented and the rest will be continuing in 2021. So we would like to enhance collaboration with ICN in more candidate recruitment to leadership for change program, allowed its resources accessible for our Myanmar nurses, sharing experience and support to initiate advanced practice nursing to be able to start nurse-led clinics. Success story for transformation of education and regulation will be most beneficial. Thank you very much.
Susan, you're muted.
Apologies, my usual mistake, I didn't take myself off mute. Thank you very much, Tate, and it's really helpful to hear what clear objectives you set from very early on in your Nursing Now campaign to try and realise in Myanmar, and we're pleased that you're continuing with that work. We're now going to move over to a completely different part of the world, to Africa, to Uganda, and we're going to hear from Catherine Odeke, who's from the Ministry of Health in Uganda. Over to you, Catherine.
Thank you very much, and greetings from Uganda again. And Nursing Now in Uganda brings greetings to all of you, and we thank you for this opportunity that you have given us to share our plans that we do really want some support and engagement with the ICN as we end the Global Nursing Now. The first one that we have is really strengthening the leadership capacity of nurse and midwife leaders And this one, we think that this can be done through continued webinars with the ICN, which they organize, and the nurse and midwives leaders can participate in those webinars, and they can gain still more skills and confidence and know as to how they are to continue and be good decision makers. Also, it can be done through nurse and midwife leaders training with the ICN leaders for mentorship, still to improve on their maybe soft skills, confidence, take them through as to how they can come up with the good habit of reading and having facts as they go for decision making. The other plan that we have is peer-to-peer in-country meetings and workshops. And then when the lockdown is uplifted, it will go beyond peer-to-peer with other countries in the globe. And then meanwhile, they can also be networking as peers. And this will help our young nurses and midwives in their, as they share. And then also the young nurses and midwives can also be participating in organized meetings by ICN, just to help them really see what goes in the globe and what ICN leaders are helping them in to come up as good leaders. The third plan that we have is to sharpen the nurses and midwife skills in specialized areas. Like in Uganda, we have oncology, cardiology, urology, and neurology, but more so in spinal. And if we could have the support of ICN by organizing some CPD sessions with with those ICN nominated experts in those specialized areas, then also organizing continuing professional development sessions with the nominated experts in those very specialized areas. This would help our nurses because they are not specialized in those areas, but they are working in those specialized wards. So having experts come and share with them and see them through building their skills, improve their knowledge, then they can also give better services. And when they're improved themselves, they are competent, then they can go and head other units in the hospital which care for the same specialized cases. And then also organizing continuing professional development is also something that we are looking at ICN coming in with the nominated experts also. They can give these CPD courses to them. And then also training still with nursing and midwifery experts from other developed countries, but that ICN will nominate for us. That will help indeed in this area. The other thing that we are looking at, that we have planned, is to build research and scholarship capacity of nurses and midwives in Uganda. We are thinking that our researches that we have been doing should go beyond, whereby we come up with journals, and this will be good, but we have not had one. So we are thinking as we continue now, ICN could come in and help us in organizing this research and scholarship capacity for our nurses and midwives by writing a joint project with them. And then also this will make them come up with something better as they come up with their first journal. The other one is to create a platform in form of a scientific journal or magazine where we can profile exemplary nursing and midwifery initiatives. And this one will be quite good. And then also we can be able to disseminate and share good practices, and key policy documents in nursing and midwifery also can come out. We also planning to hold the annual National Nursing and Midwifery Scientific Conferences. This will attract which we think at least there will be those conferences which attract the participation of ICN, and they come and share the experiences and good practices and sensitize on key policy documents that nurses and midwives need to know, so that our nurses are nurses who are knowledgeable, nurses who are competent, nurses who can be understood and talk facts. Then we have not been having the National Nurses Association, and this has kept us here, and they are not really knowing exactly how all the nurses and midwives in the country can connect with ICN, because we know ICN works with the National Nurse Associations. But we are glad that now our federation, which is the Nurses and Midwives Association, has been registered. So our plan is to have it launched, and then eventually we register it with ICN. And we know in so doing, we can now flow very well, nursing now, and then having our federation and very well linked with ICN. Thank you very much.
Thank you very much, Catherine. I mean, some really, really strong proposals around all of the areas where you see a need for capacity building in Uganda. And there's obviously a great deal of thinking gone into that. That's really, really helpful feedback for us. Now, before we go into the discussion section, where we have a couple of Nurses Association who will kick off the debate, I just would like to introduce you to a couple of people at ICN who are very important for the transition of the Nursing Now groups into ICN. One of them is going to be chairing the second half of this session. And the other one who I'll go to first is Richard Elliott. And I'd like him to say hello and just talk a bit about what he does at ICN.
Sure, thank you, Susan. Yeah, I'm Richard Elliott. I'm the Director of Communications and Events. And with Fran, who you're going to see in a second, we will be looking after you in much the same way as Catherine and Hannah have done up until now. And we know that they've done a great job with you in making sure there's been lots of interactivity between you and the Nursing Now sort of headquarters. And we want to continue with that. And that's one of the reasons why we're asking you that little question about whether the vaccinations have started in your country. And if they haven't, do you know when they're going to start? So if you can stick that in the chat, that's great for us. But we want to get your stories out. You know, that's really our role, is to get your stories out. It's what we do for our, as you know, for our national nursing associations, but we want to do that with you. And a couple of the other colleagues are on this call and maybe can just give a wave. Pilar and Lindsay, maybe they can give a wave, are really also central to helping you. And we're fortunate to have a really strong team in communications and events. And we can really amplify your stories and help them, not only get them to other colleagues around the world, but get them out onto the public domain as well. And we want to make sure that the nurses really do have a voice after through this terrible time that we're going through at the moment. And one of the ways we're doing that is with our International Nurses Day, which, as I'm sure you all know, falls on the 12th of May each year. And we're having a countdown, and today is day 93. And through that countdown, we're having many small events, and we're putting a lot of stuff up on social media. The theme for this year is a vision for future healthcare, which couldn't be more apt in the situation that we find ourselves in. And we need to get your voice heard, and that's our job. So please feel free to connect with myself and Fran as kind of the key persons in the organisation. But we'd be really happy for you to know the whole of the communication team and the wider ICN family here in Geneva and elsewhere, so that we can really support you. So we really look forward to working with you, and we appreciate you coming on this webinar today. Thanks a lot.
Thanks a lot, Richard. And I'm now going to hand over to Francesco Frasetti, who's going to chair the second half and also introduce himself, because he's probably the most key person for you in ICN in relation to the liaison with you as the groups and taking the work forward. So thanks, Francesco.
Thank you, Susan. Thank you, Richard, and thanks to all the speakers. I am Francesco. I'm the Digital Communications Officer for ICN, and I will be supporting the integration of the Nursing Now groups into the work of ICN. And I'm really excited to be here. And I'm really happy to introduce this second part of the webinar. But before I do so, Let me just remind you one more time that it would be great for us to have a few pieces of information on the vaccination of healthcare workers in your country. So if you could write in the chat box what country you are from or what country you're in. If the vaccination of healthcare workers has started already, and if it hasn't, what month it's expected to start, if you know it. If you don't know, just tell us you don't know. And then what month and maybe year, if it's next year, it is supposed to finish. And as I said, if you don't have this information, it's okay, but it would be great for us. It would help us a lot in compiling some of the key points that we have been working on in the last few weeks. So moving on to the second part of this webinar, we would like to keep this second part, these 15 minutes, 20 minutes, very interactive. So what I'm asking you to do, if possible, is if you want to talk or intervene, please let us know by either raising your hand or writing in the Q&A that you would like to take the floor, and we will make it happen. So this second part of the discussion, we are looking to talk about the intentions and plans for the Nursing Now groups for 2021 and how these groups would like to work with ICN once the campaign, the Nursing Now campaign ends in May. And yes, and we would really be happy to hear from you about this. But before we open the floor for speakers directly from the audience, I would like to introduce the fourth speaker of the day, which is Dr. Ching Chen, president of the Taiwan Nursing Association. And yeah, let me introduce him and thank him or her for the intervention. Thank you to you.
Okay, thanks, Francisco. First of all, I would like to extend our sincerest appreciation at the ICN and the Trust for Nursing for organizing this valuable webinar to echo this important and meaningful campaign. We Taiwan Nurses Association has put a lot of effort to promote as we call Taiwan Nursing Now. As you can see here, that we work out this campaign in 3 pillars. And actually, we organized that to a jingly rhymes so that well easy to be remembered. That's including 政府启动护理要动以及民众感动, so that when we communicate with our public, they will know what in each statement, what kind of petition we try to compete with that. For example, in Nursing Now here, we say we try to empower our nurses. We try to upgrade nursing education. I'm sorry, this is not working. And social image. And in 政府启动, we start with government's goal. We aim to promote advanced nursing practice, decent working condition, and innovative nursing care model. And in 民众感动 stand for people move, which we encourage political involvement and recognizing nursing contribution to society. So we use various social media such as YouTube, Facebook, Instagram, and TWNA official websites to increase the visibility for this campaign. For example, Taiwan Nurses Association worked with a popular YouTuber to showcase the nursing image, values, and contributions through an interview with TWNA president and several nurse leaders in May last year. And the video attracted more than 50,000 views. The Taiwan Nursing Now campaign indeed has encouraged our government to invest more in nursing and create more higher position for our senior nurses. For example, our Ministry of Health and Welfare has funded a 2-year research project on prospective strategy plan for nursing workforce development by 2030 and assigned more nurse leaders to serve as the deputy superintendent at government affiliate hospital in 2019. Moreover, President of Taiwan appoint our former TWNA President, Dr. Wang Shouhong, to be the minister without portfolio of examination yen in 2020. And immediately after Dr. Wang took the office, two long-pending issues of adopting computerized national exam and enhancing the competence-based education has been targeted by our government. In addition, a series of policy focused on investing nursing, such as building more on community-based home care nursing, smart nursing, has been implemented since 2018. One significant result was the development of an innovative career path for advanced practice nurse, which will be one of the focus topic and advocate issue in 2021 and ahead. So from this Global Nursing Now campaign supported by WHO and ICN, we are glad to see several petitions has been achieved. But in terms of this people moved, how to attract more recognition on nursing, it seems that we still have a lot of space to work. We would really like to seek help from ICN and welcome any interventions on this part. Try to encourage positive nursing image target on general publics. So finally, speaking of intervention on how ICN can continue to work with Nursing Now groups, we think the recent events such as Nursing in Focus, photo contacts, and Season of Giving, something like that, the ICN and Nursing Now launched were really impressive, and that did attract a lot of attention from around the world to this issue proposed. So these kinds of events are worth of continue to go further. I think that's all I would like to share. Thank you very much for your attention.
Thank you very much, President. Thank you for your intervention. And we join you in the call for more participation of nurses and participation of nurses in the work of ICN and in the work of Nursing Now, and hoping that we can bring everything together to improve the image of nurses. I would like to turn back. First of all, I would like to open against the floor for discussion. If anybody wants to intervene, please do raise your hand or write it in the Q&A if you're interested in speaking. For the rest, in the meantime, let me pass again. Sorry, we have a person that is interested in speaking, Ayush Belwal. I wonder if we can make them speak. One moment, we have to promote the person and the intervention. Sorry, yeah. So I saw a raised hand, but it wasn't there. So let me turn again to Susan and for the continuation of the webinar. Please remember, oh, again, the hand is up. One moment. Apologies for this. While we are trying to make this person intervene, and there's also Catherine Irwin that would like to speak. Thank you for raising your hand. We will get back to you right away. I would like to remind you to give us every information that you can about the vaccination campaign in your country. And yep. So Ayush Belwal, please, you can take the floor.
Hello, everybody at ICN and Nursing Now Group. I am a student personality from Republic of India. And as I have mentioned in the chat box that yes, largest vaccine drive in India has been launched. And I have personally got a first shot of the dose. And initially 1-2 days, we have a little weakness, generalized weakness. But after that, it's perfectly okay. Around millions of doses have been delivered to the students. Even in the nursing colleges, I have personally seen students also getting the doses. And it's working perfectly fine. Regarding Nursing Now Group and ICN, I would like to comment that yes, I have personal interactions with some personalities with ICN. Madam Lindsay Williamson, I have sent many emails to Madam, as I have also submitted a case study for a May IND report for the May. And uh, for the Nursing Now group, we understand that students are the driving force for this particular initiative, irrespective of the regions globally. Although senior leaders provide a lot of information, funding, and much essential support, but students are obviously the driving force. When Nursing Now was launched in India, I was attending the international endorsed event of ICN at New Delhi at Indian Nursing Council, and they also initiated and insisted that student leaders also must participate in Nursing Now meetings and spread the voice of strength to all the students so that they can get empowered and they can speak and put the issues on the table. And I have been perfectly engaging since then, especially after the initiation of Nursing Student Steering Group under the Madam Erica Burton, Senior Advisor of Policy and Health of ICN. And I think and believe that it will go perfectly fine. And I'm hopeful that Nursing Now groups will also ensure students' participation in a different section maybe, but students' participation from all the NNA countries from around the world. It would be highly thankful. Thank you very much.
Thank you very much, Mr. Belwal, for your intervention. I join your call for students to be involved in the process. We also received an interesting question here. One moment. Yep. We received a question that I would like to turn to the panel. And the question is, how can participants support the work of ICN in delivering CPD and training and development program? For example, how we can make contact. This is the question, and I open it for the panel for discussion. Okay, if no one wants to take it on, we can take it on the side. Or Howard, do you want to say something about it?
Listen, I didn't want the question to go unanswered or for no comment, because it's clearly a really significant and important question. So just to give a couple of immediate thoughts to that. The new global strategy for the strategic directions for nursing and in midwifery, one of the pillars of that strategy will be about education. And we've had separate webinars on what the actions should be in relation to that. And I think that the point that we must not forget is that we don't just talk about pre-registration education, but we talk about ongoing education. We talk about CPD, and we articulate the case perhaps more strongly. And by that I mean that I think that we make the case for CPD in relation to ongoing fitness to practice and the links to patient safety as well. A lot of people often think that spending on CPD or post-registration education is a luxury that we have when we can afford it. And I think that we need to change that narrative so that people are clear it is as fundamental as pre-registration education, that there is education to support people's ongoing competence. So I think that's an important advocacy argument to be made. And I think with all of the things, with the next strategic directions, one of the things that we need to look to be able to do is to better measure what actually is happening. So to identify where there's good practice, somebody's already talked about the strength of our collaboration as Nursing Now and ICN is about sharing good practice. So we identify where there's good practice, but we then also call out and identify where there are weaknesses. And when we come together as Nursing Now groups, as National Nursing Associations, as ICN, that is an incredibly powerful voice to say, look, we have a deficit, we have a problem, and we need to address that. So those are just some practical ways in which I think that we can work together to give a focus on what it clearly is a really important issue. We can talk to some of our the strength as well of our collaboration is that there will be some of our numbers who work in regulation, and the regulators will have a view on whether nurses are getting continuing professional development as well. So it's a really important issue. There are some practical examples, and the global strategy this year also gives us a hook on which to focus that. Back to you, Fran.
Here I am. Sorry, I was on mute. Thank you very much. I wonder if there's, and thank you for your answer, Howard. I wonder if there are any other questions from the floor or anybody else that wants to speak. I don't see anyone, so let me pass the floor back to Susan. Thank you, Susan.
Thanks, Francesco. Before we close, I would just like to check in a bit, and people can put their comments in the Q&A box if they would like to, but I will also ask a couple of our speakers to comment. It would be very helpful for us to understand, because we think this is probably something that's important and also something that ICN can support the groups in, as to whether, in terms of nursing now and what it's helped you in your groups with, whether access to a much wider platform for broadcasting the work that you're doing and the aims and objectives that you have has been useful, so that has been replicated on social media and at global level, whether that is something that's been really key for you. And the other issue is whether having access to some much bigger global debates where decisions are made about nursing, like using the State of the World's Nursing Report and ensuring the data that was in there was accurate and that can be used with government, having input to strengthening to the strategic directions on nursing and WIFRI. So having access to those kind of debates, are those two things that you think have been very important for the campaign, and are they things that you would like to continue working with ICN on? So access to broader broadcasting platforms, social media, access to decision makers globally. So I'm going to, and if anyone's got views on that, please put them in the Q&A, but I'm going to ask a couple of our panelists to comment on that. So first of all, Julia from Slovakia, just to get a sense from you as to whether those have been important things for you, and then I will go to Catherine in Uganda.
Hello, Susan. I'm here. We'll continue to cooperate with our Ministry of Health, because we are in touch with our Director of Nursing Department Office there, and we want to continue to share our experience and our future plans with campaign Nursing Now through media, through, for example, through Facebook or through television news or press releases. And I think we need to support our nurses and midwives, because the situation is very hard in Slovakia. We are missing more than 12,000 nurses in our system, so we hope it will help. And the communication is very important with our Ministry of Health in Slovakia. Thank you.
Thank you, Julia. And Catherine, I know you're very close to the Ministry of Health as well. Having that global platform through Nursing Now, has that been something that's been particularly useful for the campaign in Uganda?
Pardon?
Hello?
Yes, Susan.
Should I repeat the question?
Yes, please.
Yeah, of course. So we are trying to understand what aspects of the Nursing Now campaign have been particularly important and supportive for what you're trying to achieve in country. So I was asking whether having that wider broadcasting platform through social media, through the work that Nursing Now has done, whether that's something that's been very important, and also whether access to bigger global decision-making debates, like on the state of world nursing, like on the strategic directions on nursing midwifery, have also been important for the campaign. So we can understand better whether those are the kinds of things which really help to support and strengthen the Nursing Now groups in country.
Thank you. These are really the ticking marks. They do help a lot. And in our Nursing Now, I really say that this has played a big role, because when globally something happens and it comes out, then it attracts. The Ministry of Health is quite involved, and they support nurses and midwives. And when, of course, it goes to maybe some initiatives that nurses have come up with, and then it is broadcast, then it is seen that what nurses have been doing quietly can now be seen, and it gives that weight that really nurses carry in the health workforce. And then also when it comes to making decisions, when globally it has been broadcast and it has come out, and there are examples from which have happened in other countries, then it becomes very easy, even for us in country, to lobby and follow it up with the Ministry of Health. And having now a chief nurse in the office makes it quite easy, because in Nursing Now, we can discuss things. She's involved herself, and then she goes and takes to the top management, where permanent secretary is. And our advantage as Uganda, our permanent secretary, Dr. Diana Twine, is herself the patron of Nursing Now. So she's one of our advisors that we have. She's a patron. She's aware of what Nursing Now is all about. So it is when we nurses have picked something that maybe has not been seen, or others have seen, and we bring it and we pass it to her. Then when the chief nurse goes to top management with that, it is quite easy. So I think it is very, very important. These global debates carry weight, and then having things broadcast also carries weight, because nurses have done very many good things, but if nothing comes out, then we are doing it within ourselves. But when it comes out and it is seen nationally and internationally, then it shows that nurses are there, they are doing something, and they have been quiet, and we are coming up, we are raising the voice. Thank you.
Thank you, Catherine. You've raised some really important points there that obviously are really key for nursing, the unseen needing to be seen, and also for those countries that do not yet have a chief nurse, or do not have a chief nurse with sufficient authority and resources. I know that that's been part of the campaigning for some of the Nursing Now groups, and is obviously a really key issue for ICN as well. So I'm sure that that will continue to be one of the things that ICN will want to look at with the Nursing Now groups. Thank you so much to everyone who's participated today in the webinar. As I say, we have another one on the 18th of February, which will also have Spanish and English interpretation. I'm just going to hand back briefly to Francesco for him to round up and to remind you of how you can contact ICN going forward, and also take up some of the opportunities that Richard talked about. Thank you.
Thank you, Susan. Before we close, I would like Howard to intervene because he wanted to have a closing remark.
Thanks, Fran. Thanks, Susan. Look, just very, very briefly, I just also wanted to mention to you one other group that's important to be aware of. The World Health Professions Alliance is an alliance between ICN, the World Doctors Association, the World Dentists, the World's Physios, and the World Pharmacists. One of our speakers rightly highlighted the importance of multidisciplinary and interdisciplinary collaboration, and we're very actively doing that on a global level through the World Health Professions Alliance, and I just wanted to make sure people were aware of that as well. Please let me add my thanks to everybody for your participation today. I was really struck by the degree of alignment that there already is between us in terms of some of the key priorities and issues, and also the enthusiasm and the passion that we can clearly detect. What we need to do is to think through some of the practical steps for how this will work, of how we'll connect and work together over the coming weeks, months, and years. And I just wanted to say, to make this point as well, what we want to do is to strengthen the work you are doing in country, to strengthen your advocacy, your collaboration, your working together in country. Yes, to bring a global and an international dimension to that, but not to replace what you're doing in country, but to help to build those relationships in country, because I think you have clearly already have some fabulous relationships bringing nursing together, fitting with the Nursing Now advocacy strapline about together, which is also together the watchword for Annette Kennedy, our president's presidential watchword for her term of office as well. Thanks again, everyone. We'll be talking again soon, I am sure. Back to you.
Thank you, Howard. So let me thank again all the panelists and all the participants, and Susan for moderating the webinar. I would also like to thank Barbara and Nursing Now, the Nursing Now campaign, for their great support. And to close, I would just like to share, if I can share my screen, share like the contacts that we can, the contacts where you can actually contact us, get in touch with us, and let us know what you, if you have any additional questions or comments, if you have any other things that you would like to say about how ICN and the Nursing Now groups can work together during and also after the closing of the campaign. Thank you very much all, and I hope to see you all soon, to hear from all of you soon, and I hope to see some of you again in the next webinar, which is going to be on the 18th of February at 3 p.m. Central European Time. Thank you very much, and have a wonderful day.
Thank you very much.
Thank you
very much.
Thank you.
Yeah. Ching. Active stage video.